It's been moved by Councillor Wells and seconded by Councillor Brunton that council reconvene in open session at 4:20 p.m. Those in favor? It's carried. Thank you. We did have a closed session. We did have discussion on 2 in-camera memos, and I have nothing to report on those 2 items at this time. Okay, I would like to recess our council meeting, and I would now like to go to our Board of Health agenda. So if members could pull their agenda out, I will first ask for disclosure of pecuniary interest. Is there any to declare? Members? I hear none. Pages 3 to 8 are the adoption or correction of our Board of Health meeting minutes from our last meeting on April 25th. Is there anything there that should be brought to our attention? Declare those minutes adopted as printed from April 25th. We have 3 staff reports this evening, and as usual, we'll begin by asking Dr. Locke, our Acting Medical Officer of Health, for an update. If he has any, if he'll share it with us, please. Good to see you, Doctor.
Thank you very much, Mr. Chair. Yes, I'll try to be brief this evening because I really don't have a lot to inform the board. From the local picture perspective, we have no current outbreaks in the long-term care homes. Overall, influenza B activity is falling as it is across Canada, and we've had no community outbreaks. Having said that, we have had 1 case of mumps that was in the Tim Hortons Children's Camp in Brant County, but we were involved with it down here looking at follow-ups. This was a child that came in from Manitoba, from one of the remote northern areas of Manitoba, with a group of 30 children, came into the camp for a week and came from a community that we knew that there was already 1 other case of mumps reported. Fortunately, even though there was 70 children at the camp and also children coming in as day campers in from Hamilton by bus, we didn't have any secondary cases as far as we know. They all returned on Friday and flew back to Manitoba, and we've had no secondary cases so far. With regards to measles that I've reported on before, in France they're still seeing 50 cases of measles per month, and more than 130 cases have been reported since January of 2017. In the United States, you probably saw in the media that there's been quite a large outbreak of measles down there in Hennepin County in Minnesota. These were mainly in a Somali community, and this community has been targeted by the anti-vaccine people, and I think really shows that the education they're getting from the anti-vaccine people was probably better than they were getting from public health down there, because they were unvaccinated. Most of them were unvaccinated, so they were a susceptible population. We've had an outbreak of cholera in Mexico, with 170 suspected cases of cholera reported since January of this year. Members of the committee may also have noted that Ebola has now sort of raised its head again in the Democratic Republic of Congo, and they're sending lots of vaccine that was produced here in Canada out there to try to quell this outbreak. In Brazil also, there's been quite a very large outbreak of yellow fever down there, and our yellow fever supplies here, I run a travel clinic in Brent, our yellow fever supplies, we cannot get vaccine at this point in time, so people traveling to Africa and South America, we have a very restricted supply, if any, of yellow fever vaccine. And I think that's it, unless there's any questions, Mr. Chair.
Dr. Locke. Is there any questions? Councillor Columbus first, please.
Thank you, Mr. Mayor. My question is with respect to ticks. And I know there's a lot of camping going on. The campsites were quite full on the weekend. I know it rained a lot. Some people left early. But anyway, the tick situation, can you elaborate on it? And what should people be doing? Like, do they go to the health unit if they find a tick on their animal or on their body? And is there a blood test for it? What's the process? People are asking that question. Because there's a lot of ticks out there.
Through you, Mr. Chair. Yes, there are lots of ticks out there, and the current thinking is that from the entomologists that this is because we're seeing the effect of global warming and the range of the ticks are increasing. It's only the deer tick that transmits Lyme disease, and certainly if people feel or come across a tick that they have on them, they can certainly bring it into the health unit to have it identified. We send it away. It's a secondary form of surveillance that we do in the health unit, and there is a move to get away from that because it's after the event and move to active surveillance, which is dragging for ticks in an area for a morning or a couple of hours in different areas to see whether or not the incidence of and the numbers of and species of ticks can be identified. In general, there's quite a bit of controversy about testing for Lyme disease. It's fairly simple in the acute stages, but when you move into chronic Lyme disease, there's a lot of controversy about adequate testing for that. Our testing in Canada is somewhat different to that which is available in the United States, and controversy arises as to whether or not the testing we do in Canada is adequate when compared to that of the United States. However, it seems that from my reading on this, that the testing that's done in the States is also not absolute, and the case for chronic Lyme disease is the book is still open on that.
So just to follow up, are medical expenses then covered if someone suspects they were bit by a tick and they think they have Lyme disease? What's the next process? Do they?
In the acute phase, if through you, Mr. Chair, sorry, if you suspect you've been bitten, the tick has to be attached for greater than 24 hours in order to transmit the disease, because the virus has to move through the tick system to its salivary glands before it can be injected into you. So it has to be attached for 24 hours. So the first thing would be, if you're in a tick area, would be to have some tick surveillance when you get home to make sure that you don't have any ticks attached. If you do, then it would be appropriate to go see your family physician, because not always does this target rash that's pathognomic of Lyme disease. It's not always as obvious as the books would make out. Not everyone gets it, and not everyone gets bitten by a tick that's carrying Lyme disease actually come down with Lyme disease. So see your GP and try to get appropriate treatment if you have the symptoms and you get diagnosed with Lyme by the family physician. He can put you on an antibiotic.
Thank you.
Councillor Oliver, please.
Thank you, Mr. Chairman, and to Dr. Locke. On the same line of questioning, Doctor, from Councillor Columbus, I heard you use the term a protocol for dragging for ticks. Is there a standardized protocol, and do we in our health unit know the technical criteria, and are any of our staff trained to be able to do that dragging or sampling of an area for ticks?
Yes, this is this has been recommended by Public Health Ontario.
Yes.
That they're calling this active surveillance rather than passive surveillance. Passive surveillance would be bringing a tick in for identification if you were bitten. Yes, we do have the ability to do that, and yes, we are looking at doing this maybe later this year in the fall or next year.
Very much, Mr. Mayor. And I only bring it up coincidentally. I had a meeting over the weekend with a number of property owners in Turkey Point, and of course, Turkey Point is one of our major problem areas. And so I, with your permission, Mr. Mayor, will follow up with Dr. Locke and staff because I think it would be a good idea to use that as a pilot of some sort. So
Yes.
thank you.
Any other questions? It's been moved by Councillor Wells and seconded by Councillor Oliver that the update of the acting medical officer of health be received as information. Discussion? Those in favor? It's carried. Thank you. We have two staff reports this afternoon. First one is staff report HS 17-10. This is the Haldeman and Norfolk Health Unit Harm Reduction Program. A bit of an eye-opener when I read this. Susan, I'll let you introduce this and we'll go from there. Thank you.
Thank you, Mr. Chair, and through you to our Board of Health. I'd like to introduce Tamara Robb. So Ms. Robb is one of our public health nurses and has been leading our harm reduction program. And with her this afternoon, we have Adrian Andrews, who is our senior public health inspector. And so the two of them are a pretty awesome team, and they've really helped us to make connections to our community and to start to articulate what we need to do to help reduce the harm in our community.
Okay, welcome ladies, and we're ready for your report.
Okay, we have a presentation that's just not showing on the projector right now.
Okay, it's down on the screens, but not on the projector. We'll get that up in a moment. We'll continue.
Oh, okay.
We have it on our screens at the desk. This will come up eventually. But we'll get started.
Is it there? Okay. Thank you for the introduction, Susan. So our presentation today focuses on the Haldeman Norfolk Health Unit's Harm Reduction Program. This presentation will highlight the Health Unit's Harm Reduction Program by defining harm reduction, discussing the benefits of harm reduction, shedding light on the current opioid situation in Haldeman and Norfolk counties, discussing the Haldeman Norfolk Health Unit's successes to date with the program, and then the next steps we plan to take. So let's briefly touch on what is harm reduction. Harm reduction is a practical and non-judgmental set of strategies to reduce individual and community harms caused by drug use, namely injection drug use. The main focus is taking incremental steps to reduce these harms rather than eliminating drug use, as abstinence from drug use may not be an achievable goal for all. The harms of most concern when regarding injection drug use are bloodborne viruses such as hepatitis C and HIV. Reusing or sharing needles or other injection drug supplies can increase the risk of exposure to these viruses. Therefore, providing clean injection supplies can help reduce transmission of hepatitis C and HIV. Harm reduction strategies are evidence-based, and they're most effective when used in conjunction with other strategies such as prevention, treatment, or enforcement. Harm reduction strategies are everywhere. It's not a new concept. For instance, there are some classic examples, such as using sunscreen for sun health protection, or the pasteurization of milk in regards to reducing the incidence of foodborne illness caused by harmful bacteria in raw milk. Another harm reduction strategy is a needle exchange program, also known as a needle syringe program. Both names are used interchangeably, that help to reduce the transmission of hepatitis C and HIV through providing safe injection drug supplies, so then that way these supplies don't need to be reused or shared. Needle exchange programs have been in existence in Ontario for the last 20 years, and the Haldeman Norfolk's program has been in existence since 2009. Under the Ontario Public Health Standards that are published by the Ontario Ministry of Health and Long-Term Care, the Haldeman Norfolk Health Unit and the other 35 health units in Ontario are mandated under the Sexual Health and Sexually Transmitted Infection Prevention and Control Protocol to provide access to harm reduction supplies through needle and syringe exchange programs, which may include other evidence-informed harm reduction strategies in response to local surveillance. These other strategies can include the provision of clean and sterile drug-using equipment, condoms, counseling, skill building and education, and referrals to addiction treatment programs. The Haldeman Norfolk Health Unit receives funding from the Ministry of Health and Long-Term Care to purchase supplies for the needle exchange program. These funds allow for the purchase of needles, sharps containers, and the associated costs related to the sharps disposal. Supplies not funded by the Ministry of Health and Long-Term Care are provided free of cost by the Ontario Harm Reduction Distribution Program. So now at this time, I would like to bring to your attention, some of you have already opened them, the black bags that have been placed in front of you. These black bags are bags that we give out to clients of our needle exchange program that contain safe drug injection supplies. And then there's also pictures up on the screen, and then I guess in front of you on your monitors as to what the items we'll be talking about are. So the first picture, picture number 1, relates to the needles that we give out. And Tamara's got an example of them here. So we give out 2 different sizes, either short needles or long needles, and clients select them based on their preference. The second picture are vials of sterile water. And these are used to mix drugs that are used for injection. The third picture is vitamin C. And vitamin C is used to make insoluble drugs like brown heroin or crack cocaine into a water-soluble form so it can be injected. The fourth picture are spoons and cookers. Spoons, also known as cookers, with their filters. So prior to injection, drugs in powder, solid, or tablet form must be mixed with the sterile water or the vitamin C, depending on the drug, to break it down into a liquid solution with heat. The filters trap solid drugs which have not been liquefied during the cooking process. It's important to use the filters because if injected, that could lead to illness or infection. The next picture, picture number 5, is a matchbook, which is used to heat up the cookers. It's used as a source of heat. Picture number 6 are tourniquets, and these are used to tie off or restrict blood flow, causing the veins to bulge and become accessible for injection. Picture number 7 are alcohol wipes, and these are used to disinfect the area where the drugs are to be injected. And then lastly, picture number 8 relates to sharps containers. At the health unit, we give out 2 different sizes, a small size, which holds about 100 needles, and then a larger size, which holds about 300 to 400 needles. Sharps containers are a very important part of a needle exchange program because injection drug users can store their used needles in these containers, and then they can bring them to the health unit to safely dispose of their used needles as well. The items that we distribute as part of the needle exchange program are available to clients of the program at the Haldeman Norfolk Health Unit's offices. These include the offices in Simcoe, Caledonia, and Dunnville. These supplies are also distributed by our community partners, which include pharmacies, such as the Pharmasaves in Delhi and Port Rowan, Hauser's Pharmacy in Dunnville, and our newest partner, the Waterford Pharmacy and Health Food Store. We also have partnered with medical treatment centers that happen to have methadone treatment programs, and these include the Water Street Clinic and the Hope Pharmacy, both located in Simcoe, and the Caledonia Clinic. So not only can needle exchange program clients obtain clean injection supplies at our offices and from our community partners, but they can also return their used supplies in the Sharps containers to these same locations. A third party hired by the Haldeman Norfolk Health Unit and using funds from the Ministry of Health and Long-Term Care collects the Sharps containers and then destroys the needles in a safe manner. Safe Sharps disposal is an important part of this program, as providing this service reduces the amount of needles that are discarded in the community. It's also important to note that our community partners participate in our needle exchange program free of charge, as they recognize the importance of the program and how important harm reduction is to our community. There's many benefits to running a harm reduction program, and to name a few, include reduced transmission and prevalence of hepatitis C and HIV, and this is due to the provision of clean needles. And another benefit is the reduced costs on the healthcare system, as it is less expensive to run a harm reduction program and needle exchange program than it is to treat a community member for hepatitis C or HIV. There can be a reduction in crime scene, as injection drug users won't need to resort to crime to obtain the supplies that they need to inject drugs safely. And then, as being a part of the program, they can be enrolled in treatment as well. There's reduced instances of risky behavior surrounding drug and sexual practices. And then there can also be increased referrals to treatment programs and health and social services programs, such as Ontario Works. And now Tamara is going to explain about the opioid situation in Haldeman and Norfolk counties.
Thank you, Adrian. Okay, so on your monitors, you'll be able to see this infographic that our communications department developed. So this is kind of a snapshot at this point in time as to what's going on in Haldeman, Norfolk. If you want a copy, we also have some print copies available as well. So the first one is looking at our illicit drug use statistics. So these are self-reported statistics, which means people have disclosed themselves that they are involved in illicit drug use or recently have been. And our rates are actually higher than the provincial rate in both males and females for illicit drug use. Then we look at prescription opioid use. So these are prescriptions that people have received from their physician. Usually people are prescribed opioids to manage pain, whether it's chronic pain or cancer-related pain, a number of different reasons. Opioids can include things like OxyContin, heroin, morphine, Percocet, Dilaudid, fentanyl, codeine, just to name a few. So these prescription opioid use stats, in 2015, Haldeman Norfolk had the highest percentage of individuals taking high-strength opioids when compared to all other municipalities in Ontario. Now, this statistic only captures those individuals who utilize the Ontario Drug Benefit Program. So those would be individuals who are over 65, who have a valid health card, who are also on Ontario Works or Ontario Disability. So people who are accessing opioids through their private prescription drug coverage or paying out of pocket, it wouldn't capture them. So this statistic is likely underreported. In our LIN, so Haldeman, Norfolk, Hamilton, Brant covers our LIN, we ranked number 1 for rate of opioid users in 2015. The next one on there is hepatitis C. So as Adrian mentioned in her part of the presentation. Sharing injection drug equipment is the most common risk factor for hepatitis C, and that's one of the main reasons we do a harm reduction program. So when looking at our rates from 2011 to 2015, our rates in Haldimand, Norfolk were higher than the provincial rates in both males and females. When we look at males on their own, Haldimand, Norfolk has double the provincial rates for males in the 25 to 29 age group, so that's our young males. And in the females as well, we're seeing the highest in the 25 to 29-year-old age group, and we're almost double the provincial rate for that age group. Why that age group is the highest? Majority of the time that is related to sharing of drug use equipment, and that's how they contracted hepatitis C for that age group. Another one we focused on, looking at overdoses, understanding that oftentimes if people are involved with illicit drugs or even opioids, or they may not even be realizing that they are using some of these opioids that have been laced into their drugs that they are using, you're going to expect to see some overdoses. So being in contact with both Norfolk and Haldimand EMS, we were able to obtain these statistics. So I want to thank Sarah Townsend, who's here today from Norfolk EMS. So Norfolk EMS actually saw drug overdoses quadruple in 2016 from January to December comparatively. So they're seeing a substantial amount of overdoses. 37 calls for overdoses in 2014, 59 calls in 2015, 90 calls for overdoses in 2016, and just from January to March of this year, they already had 23 calls. Now, these are just calls that are called in as overdoses as well. So this number, or these numbers, are actually very underreported too. If a call is received for our EMS to respond to somebody who doesn't have vital signs or is in respiratory distress or unconscious, whatever it may be, those won't be captured as an overdose at this for these statistics. So it's very underreported. Another thing that Adrian mentioned was our distribution of safe injection supplies. And this is associated with significant decline in equipment sharing when we are providing these equipment to people. So we've seen, ever since we had our methadone clinics come on board, we've seen a huge increase in the uptake of our supplies, which is great. It means more people are getting the supplies that need to be having the supplies. In 2014, we gave out just over 37,000 clean needles and supplies in our community. In 2015, that increased to just over 64,000, and that's the year we had our area methadone clinics come on board. So again, they've been a huge partner with us in that. And then last year, in 2016, there were over 108,000 needles distributed in Haldimand and Norfolk. Most of that is actually right here in Simcoe. Norfolk has a bigger uptake of that right now than Haldimand does. So that's a little kind of brief overview of what's happening in Haldimand, Norfolk. And then I have a couple more statistics that I'm going to share that we just recently received information on these. So these graphs here, the top one is Ontario, and the bottom one is Haldimand, Norfolk. So these are rates of opioid-related deaths, looking at all ages. So at the top one, which is Ontario, you can see it's gradually been increasing, and that graph goes up to 2015, because that's the information we have at this point. And then Haldimand and Norfolk is the bottom one. You can kind of see it's been up and down, but since 2013, there's been a significant rise in opioid-related deaths. So we went from a low of 2.7 deaths per 100,000 in 2013 up to 9.9 deaths per 100,000 in 2015. And it may be difficult to see the numbers on the side there of the graph, but Haldimand Norfolk's is around 9.9, whereas the one for Ontario is just below 5 deaths per 100,000. So we're a lot higher in that. Then the next graph, I broke apart male and female. So male is the blue one, or the top line, and then females for the top graph is the bottom line. So the top graph, once again, is Ontario. The bottom graph is Haldimand, Norfolk. So you can see when looking at Ontario's, the graphs are very similar in their shape and increasing over time. Then when you look at Haldimand and Norfolk, ours, again, we have the kind of peaks and valleys like in the previous graph. However, the yellow line's the one I want to draw your attention to on the bottom graph, because that's the females in Haldimand and Norfolk, and we've seen a steep increase in females dying of opioid-related instances, and that's been from 2013 right up to 2015. So that's that big spike that you're seeing there in our females. So this breaks down, we go through 2013, then 2014, 2015. So blue bars being male, yellow bars are female. So you can see in 2013, we had some females. The last graph on the right-hand side, or the last two bars, that it's all ages. So you can see at that point, the males were a little bit higher than the females when it came to opioid-related deaths. Switch to 2014, the females have now gone ahead of the males in relation to opioid-related deaths, and we've seen the highest that year in the 45 to 64-year age group. And then go to 2015, and the females are significantly higher than the males, more than doubling them in the rates of opioid-related deaths here in Haldeman, Norfolk. And the 25 to 44-year-old age group surpassed the 45 to 64-year age group for that year. So some successes to date based on all of that information. We'll let you know some things that we have been working on here at the health unit. We've been working very closely with OPP, both Norfolk OPP and Haldeman OPP. We did some presentations with their sergeants and then with their staff on our harm reduction program, including our needle exchange program, and letting the officers know what the potential risks are in their day-to-day job, understanding that they may apprehend somebody that could have a used needle perhaps on them, and trying to keep our officers safe. So we started a sharps container project initially with the Norfolk OPP, and our funds from the ministry to run this program, we were able to purchase sharps containers and brackets for the officers to have equipped in their cruisers, and also puncture-resistant gloves and tongs so that if they did encounter a used needle or syringe in their day-to-day work, they would be able to safely dispose of it and prevent any injury to themselves. So to date, we've been able to equip 20 Norfolk OPP vehicles with these supplies and 20 Haldeman OPP vehicles as well with these supplies, and we'll continue to provide them as they have more vehicles that need them. The officers can also bring any used syringes in the sharps containers back to the health unit for disposal. So we've provided them with some harm reduction education too to their staff, and also sit on what's called the situation table, which is a number of other community agencies as well, where we discuss different high-risk situations that may be going on with individuals or families in our community, and work together to see how we can assist them. Another partnership similar to with the OPP is we've partnered with our local parks and roads divisions in both Haldeman and Norfolk. So if an individual does happen to find a used needle or syringe out in a public park, then it's often our parks and roads division that gets called to properly dispose of that needle or syringe. So we have provided our parks and roads departments with the sharps containers once again, and puncture-resistant gloves and tongs, so that they can ensure they can properly dispose and safely dispose of anything they may encounter, and then they again can bring that back to the health unit for disposal. Most recently, we started meeting with a number of community agencies at the health unit. And so at the end of 2016, we had a few community agencies approach us after there was some media about overdoses that were happening in our community, and they wanted to work with public health to see how we can address this as a community. So that lists the community partners that we have on board to date. We've done some really great discussions and meetings. We've had 3 or 4 now. So we have representation from all different agencies representing both Haldeman and Norfolk, including EMS, OPP, the hospitals, mental health and addiction services, etc. And what we've been working on most recently is planning some educational events for our community, wanting to get this information that we shared with you today out to the community so they understand what the potential risks are, where they can go for any supports, treatment, whatever it may be, and so that they can, we can all work together to help address this problem in our community. So our first event, hot off the presses, we're going to be having a Let's Talk About Opioids event Thursday, June 15th. This is going to be in Simcoe at the library in the evening. So doors are going to open at 5:30. We'll have some tables and stuff set up with community agencies to provide resources. And then we're going to have the actual event from 6 to 8 p.m. So we're going to have speakers from the OPP to talk about what they're kind of seeing from their standpoint on the street, EMS as well, Rolston's Pharmacy. So we're going to have Allison, who's here from Rolston's Pharmacy, she's been a big partner with us, present as well, and also physician specializing in addiction treatment from one of our area medical clinics, who is here today as well, Dr. Dillon. They are going to all share some information just to provide more education to the public. So stay tuned for this. This is going to be coming out this week. And promote it as much as you can, and it's open to anybody. We're also going to be having a similar event in Haldeman the following week. We're just firming up location and dates, so as soon as we have that, we'll make sure we pass the information along. So this is something that all the community agencies we've been working on diligently over the last couple weeks. So another thing we've been working on is naloxone. So naloxone is the medication that reverses the effects of an opioid overdose. So if somebody is experiencing an overdose related to opioids, if they're given the naloxone medication, it can reverse that overdose. The Ministry of Health and Long-Term Care is funding this program. They have a pharmacy program. So at this point in time, there's select pharmacies in Haldeman and Norfolk that have come on board for this program. So anybody can present to these participating pharmacies with their health card and obtain a naloxone kit. As well, we have been working closely with Rolston's Pharmacy, and Rolston's has been working with some community agencies who are interested in having naloxone available for their staff, who may, in their day-to-day work, have the potential of encountering somebody who has overdosed. So Rolston's Pharmacy has been working very closely with a bunch of our community agencies to assist them in getting that up and running, and they've been very successful in that. And we're thankful to have them on board. And then also the health unit is going to be launching our own naloxone program as well. So the Ministry of Health funds that program too, and many of the other health units are already participating in this program. So people will also be able to, in the coming months, be able to come to the health unit and receive a naloxone kit there too. So there's two different kits that are available. The ones available through the pharmacy is an injectable naloxone. So that means that the medication is administered with a needle. And the pharmacist will go through with whoever wants one, how you use it, safe use of it, etc., all the health teaching that's necessary. And then when public health gets it, we actually have the nasal spray, which is just another version of the naloxone, a little easier to administer in some respects because it's just a spray that goes right in the nostrils, so you don't have to worry about using a needle or anything like that. And the public health program, you don't need to present a health card for that one. So stay tuned for that. That'll be launching soon. But the ministry has this big push right now to get naloxone as available as we can get it to help prevent people from dying from these drug-related overdoses. Another thing we've been working closely with our local LIN, so the Local Health Integration Network. So ours is the Hamilton, Niagara, Haldeman, Brant, Lynn, and they have a sub-region, which is our Haldeman and Norfolk region, where they're looking at addictions treatment and what it looks like currently and what it's going to look like in the future state. So we already had 2 half-day planning meetings where we met and brainstormed with a bunch of other agencies, and our next meeting with them is actually this week on May 25th. So again, we're working with a bunch of different agencies to try to address this in our community. So next steps, what we're working on, the rollout of our naloxone program, as I mentioned. We're going to continue working closely with Rolston's Pharmacy to ensure access to naloxone for any agencies that are interested in having it. We always offer community education events in partnership with our local agencies, so the upcoming ones in June. We also have presentations that we've done to different community agencies just for information on overdoses, fentanyl, et cetera. Continue to offer our needle exchange program. Future consulting with the planning department regarding a possible methadone clinic zoning. So we're going to be working closely with them if that comes to head again. And continuing to meet with the LIN as requested to discuss addiction services in Haldeman and Norfolk. This is just a list of some really useful resources if you do want some more information. So the top one, the Ontario Harm Reduction Distribution Program, that's where we get the bulk of our supplies from, except for the needles and sharps containers, so they have some great resources there. There's a really good documentary that PBS did called Chasing Heroin. Highly recommend watching that. It's very eye-opening. There's some best practice documents there as well, and there's also some information on methadone if there's any questions you have about what exactly that treatment entails. And thank you very much for your time.
Turn that on. Tamara and Andrea, thank you very much for your report and your presentation.